So basically, translocation 11;14 is seen in approximately 40 to 60% of patients with AL amyloidosis, which is a considerable number compared to patients with multiple myeloma, which is quite lower. And it's associated with an increased expression of cyclin D1, BCL1, and BCL2, as well as an increased inhibition of apoptosis. And it has become evident throughout many clinical studies that it is associated with an adverse prognosis in these patients. However, reviewing the data, it seems that this is most likely an effect that has to do with a decreased sensitivity to treatment with Bortezomib. So there are a number of studies where we see that patients treated with daratumumab or autologous stem cell transplantation do actually as well as patients that do not have translocation 11;14, or even better in some instances. And in the last few years, we have been increasingly using BCL2 inhibitors such as venetoclax, and there are a number of other BCL2 inhibitors in clinical trials being tested. So these drugs probably will offer an advantage to patients with translocation 11;14 as they directly inhibit BCL2. And they might, this patient group might even do better than patients without the translocation. In our study, we assessed 146 patients, and we found out that translocation 11;14 is associated with a shorter time and a higher frequency of event-free survival. So event being defined as hematological progression or organ progression or suboptimal response or death due to any cause. However, it does not seem that this translocation has an adverse effect on overall survival, so it has a neutral prognostic effect, and this might be due to the fact that we're using increasingly more effective salvage therapies and treatments. But still, it is something to take into account for our patients, and hopefully in the future we'll be able to incorporate BCL2 inhibitors at subsequent or even first lines for these patients.